Hello, I'm Dr. Kim Nichols, board-certified dermatologist and founding director of Nichols MD of Greenwich in Greenwich, Connecticut. Today we're going to be talking about the procedure called microneedling with PRP. So microneedling is the technique, and that involves doing little serial punctures in the skin with a little micro pen and then applying an ingredient on top that seeps deep into the skin in those microchannels that then quickly close up. There's different ingredients that can be applied to the skin: growth factor, hyaluronic acid, and in this case, the most effective is PRP. So PRP is plasma reactive protein, and that's found in our blood. So when you come in for a PRP treatment, you come in, we take a vial of blood, we spin it down in a centrifuge, and out comes a yellow plasma that we call liquid gold. And the reason we call it that is because it's full, chock full of platelets that derive stem cells. And these stem cells trigger our own collagen production 10 times more than a simple growth factor serum or hyaluronic acid hydrating the skin. So we use PRP and get the best effects with the microneedling with the PRP. Microneedling with PRP can treat a variety of conditions such as large pores, acne, dark spots, melasma, fine lines, aging, really everything. It can even help to tighten the skin, and the results get better and better the more treatments you do. So this is the type of treatment that you can do in a series when you have a condition that you really want to treat quickly, but you also do maintenance treatments, down the line to keep that skin plump and to keep those conditions at bay and to improve the nature of the skin in general. So it really is something that you can continue to do throughout your aging years. So today we're going to be doing the microneedling with PRP with Susan. How are you, Susan?
Good.
Good. So Susan is a 61-year-old, I can't even believe it, 61-year-old beautiful woman who has certain conditions that she wants to treat with the microneedling with PRP. So Susan, what's bothering you? What brings you in getting this treatment?
So I'm interested in getting rid of some fine lines, some large pores that I have, and some age spots that I have on the side of my face.
Yeah, and Susan can expect to get great results with the microneedling with PRP. She would be somebody who I would suggest starting out with a series of probably around 6, and these can be done as early as close together as 2 weeks. Most people do once a month just to, spread it out a bit. And you'll continue to see improvement as we go. Like I said, even with the first treatment, you're gonna get that initial glow, tightening of the skin, but it'll get better and better, especially those large pores. Mm-hmm. That's one of my favorite conditions for the microneedling with PRP. So I think you're gonna love it. The reason I brought on microneedling with PRP to Nichols MD of Greenwich, and believe me, it's become one of our most popular treatments, is because it's a treatment that can treat almost anyone in my practice. Starting from the teenager who's got some acne and dark spots and wants to treat those in a non-invasive way, all the way to the 60, 70-year-old patient who's got some more, severe sun damage or larger pores. So it really fits the whole gamut, and that's why I love microneedling with PRP as a treatment in this office. So now we are about to begin the microneedling with PRP procedure. You ready, Susan?
I'm ready.
So before we started, Susan had a numbing cream that we applied for about 30 to 45 minutes. And that was placed on a clean face. And during that period, we drew her blood, took a vial, and spun it down in the centrifuge. And soon we'll be showing you the plasma that came out. So now I'm gonna apply hyaluronic acid serum, which is our first coating. Hyaluronic acid is excellent for plumping and hydrating our skin. So it's nice as the first layer that we're gonna use for our treatment. So we've already applied most of it. I'm just gonna do a last application here. You can see kind of the glow already. And in terms of what Susan should expect, it's really gonna just feel like a little bit of sandpapery feeling. The numbing cream that we use here is very strong and effective, so you really won't feel much. So it's very tolerable, quick procedure. All right, let's start. And here's the micro pen that we will be using for this procedure. I like to show it because it illustrates a very important point, and that is, this is a medical in-office procedure. However, you will see that there are some home devices that claim to do this technique. Sometimes it's called derma rolling, or some other, micro technique, that type of thing. But those procedures, first of all, are not going to be anywhere near as effective. They don't go as deep as these needles do in the micropen, not even close. And it's also not safe to do a procedure like that at home. Remember, you are breaking the skin. So please, if you're interested in this procedure, always do it in a doctor's office. Okay, so let's begin. Again, we're going to do 3 rounds on the different areas of the face. And on my pen, I have different lengths that I can use in terms of the micro needles that come out. I usually will use something a little less deep for the forehead bony areas and deeper for areas such as the cheeks, which are thicker skinned or have, more severe issues. So Susan should expect to feel a little sandpapery feeling as I make my passes. And these passes, as you see, are making these micro channels. So you should start to see the little channels and bleeding come out. And those little bleeding channels and spots show us that we're exactly at the depth that we want, and she's going to get a great result. Okay, so after I finish one area, my assistant then places the PRP on that area so it starts to penetrate through those microchannels. And now I do my next pass, usually in a various direction. And you'll see with each pass, more of these microchannels come out. So she's really going to get a beautiful result. Like I said, this is a treatment that anyone can do, and on any body part. So, people think of the face, of course, first, but I'm always one to say anything we do or apply in terms of skincare products on the face should the exact same thing be placed on or done to the neck, the décolleté, the chest, and the hands, because these are areas that all get sun damage and aging over the years. So our patient Susan has just completed the MicroNeedling with PRP treatment. As you can see, she does have some redness, pinkness to the face. We've applied that final layer of PRP, which will sit on her face for about 10 minutes. When we finish, she should expect to be red. So we tell patients that they're gonna be red the day of, not to have any big events planned for that night. But then the redness and the pinkness tends to drop off pretty quickly. So even by the morning, she'll be kind of a little bit of pink, but nothing too red. And then over the next day or two, that subsides. And really, she's just a little sandpapery, some of those little brown spots coming up, but the social downtime is minimal. And I will be giving Susan a skincare regimen recommendation to use after the treatment and ongoing. And we can expect to see each other for the next treatment in about 3 or 4 weeks. And Susan is somebody, like I said, who will probably want to do an initial series of about 6 treatments to get those wow results, and then do maintenance treatments every 1 to 3 months for maintenance of those great results and improvement ongoing. So if you have any questions or are interested in microneedling with PRP for face, neck, any area of the body, please call us at 203-862-4000 or go to our website for more information at kimnicholsmd.com.